I'm Dr. David Hill, and today we're going to be talking about remedies for sinus pressure fever. Now, in medical terms, sinus pressure fever doesn't really mean anything, but there are a lot of conditions in which patients feel both sinus pressure, here or here usually, and fever. Those conditions are usually infectious. They usually start as viral conditions. That said, how we treat them depends on the age of the patient. Young children do not tend to feel sinus pressure even when they get sinus infections. That's because their sinuses are not fully developed. So it's very unusual for a younger child below age about 10 to complain of sinus pressure even if he or she has a sinusitis. To detect sinus infections in those children, we rely on symptoms such as fever going on more than 3 days, runny nose going on greater than 10 days, or cold symptoms that are getting worse rather than better after the first week. In older children and adults, sinusitis may well present with discomfort in the sinuses. This often is accompanied by a fever, but sometimes the fever may be mild or may not be present at all. That said, there are usually some pretty prominent cold symptoms as well. What you do for those people still depends on age. In children, we find that antibiotics are helpful for acute sinusitis. The studies on adults have not shown that antibiotics really do that much good. A lot of doctors use them anyway because we think, hey, it's an infection, we should be able to treat it with antibiotics. But the literature on this has been rather disappointing. So if that doesn't work, what does work? Well, especially in adults, nasal sprays that contain corticosteroids that decrease inflammation in the nose are the one medical modality that has been shown to relieve symptoms of acute sinusitis. Another modality that's not a medication is washing the sinuses out with a saline wash, a normal saline, which you can make with 1 cup of water and a half a teaspoon of salt. And you can put that either in a syringe or in a neti pot, which is a thousands-year-old Indian teapot for the nose, essentially, and wash out the sinuses. Now, that can be overdone. If you do that too much, you can actually irritate the sinuses. You don't want to overdo anything. But used in moderation, it may well relieve the symptoms of a sinus infection. So remember, if you have a fever and sinus pressure, especially if the fever is going on greater than 3 days or is over 104 degrees, you want to seek care for that. That may be an infection that needs to be treated. However, also, the neti pot and nasal saline washes can help as well. Talking about how to relieve sinus pressure fever, I'm Dr. David Hill.